So, spirituality and health. Spirituality, if I can just give an analogy, if spirituality is the Atlantic Ocean, health is the Pacific Ocean. So, where does it meet? Or is it even inseparable? The oceans definitely meet. And when I went to Caribbean island, people were talking about, oh, this is where the Atlantic meets the Pacific Ocean. And they said that the one thing that to me was like striking to me was the water is very calm when the two oceans meet. And one ocean has high temperature, the other one is very cold. So it just equalizes the temperature and it just brings the equanimity. So that I really was contemplating on that principle. So whether spirituality can exist without health or health can exist without spirituality. So that put the seed for the deeper conversation within myself. And I hope I can do justice. I'm just sharing Swami's knowledge and it is purely my understanding. So kindly bear with me, whatever I'm going to share here today. So this is the response. What is spirituality in your own words? And each and every one of you, like beautiful answers. Knowing myself, my connection with the God, right? And living in constant integrated awareness with the divine. So these are all very striking answers. I felt there's so much. I don't want to read the whole thing, but it was beautiful to go through it. So we all have the deeper understanding what spirituality means. We all know the term, the spirituality. So in my understanding, I just wanted to break it down. What is spirituality? Sometimes there is a confusion. Is it religious background or just the chanting and doing all the rituals? Is that spirituality? But Swami has beautifully explained none of that matters. You can do meditation, you can chant, you can do everything. But what? What is spirituality? So I just wanted to apply my medical mind here. Spirit is nothing but there's a life force, there's a conscience that is constantly present in each and every one of us. Swami said, I separated myself from myself to love myself. So that's the conscience, that is what we are. And so, how do we experience this spirituality? How do we even experience that spirit that is present in all of us? What is the ritual practice we have to do? That is constant integrated awareness. So CIA, constant integrated awareness, we do a lot of study circles. How deep can we go? Can we practice this constant integrated awareness every breath of it? So that is the reason we're all here to even more dive deep and help each other. The satsang definitely help each other to grow spiritually. So doing that ritual of constant integrated awareness of who am I, that leads to the real spiritual person who really we are, experiencing that oneness. The spirit is not in one place here, not there. That reminds me of the Radha and Meera. They saw the conscience of Krishna everywhere, whether it's the drop of the river, is it the leaf, anything. Even when Krishna came in the physical form, that didn't really matter to them because they're already seeing Krishna everywhere. So even Albert Einstein says every atom of this universe is permeated with the conscience of the love. So the collective consciousness, if we do every single thing, then we really become spiritual. So that's the meaning Swami has said as well. And I have a beautiful Swami's discourse, but Swami gives the answer to everything in 2 minutes. So I don't want to give it out in 2 minutes. So I was just holding the video towards the end of the talk. So what does health mean to you? This is the response I got from all of you. Resourcefulness. Definitely, we need to have the knowledge. Being active, doing exercise, physical, spiritual, mental well-being, emotional well-being. There are a lot of beautiful answers that you had come up with. let's see what World Health Organization says, and let's see what Swami says as well. World Health Organization says health is a state of complete physical, mental, and social well-being, and not merely the absence of the disease or infirmity. So all of us here, pretty much we may think that yes, I'm physically fit, and mentally pretty much I'm happy and content, and I know what I'm doing. Um, there is a beautiful quote they have put, the social well-being. That social well-being is something they didn't want to put a spiritual well-being. They're very diplomatic in a way. The social well-being is the oneness. If the society is not healthy, the individual cannot be healthy. If the individual is not healthy, the society cannot be healthy. So we are interconnected in that oneness. So, and we all experienced that during this COVID situation. And even now, the mental health has taken a big toll because the society, what is happening in different parts of the world. And when I interacted with young adults, they're just broken down what is happening in the other parts of the world. It is just nobody can be peaceful and restful, even though personally there is nothing going on in their life. So that flame has to be there so that, but we cannot stop at that level. That is just empathy that causes more pain to us. We don't want to be part of the pain. We want to be part of the solution. So that's where comes the action. When we take compassionate action, then we become healthy and then we become part of the solution. So that's what the definition of World Health Organization. So what Swami says is the health is at the physical level, mental level, and the spiritual level. He says you're not the person, we are all very familiar with this. At the body level, I'm thinking that this, yes, I'm Ramadevi, I'm pediatrician, blah, blah, blah. I'm just kind of thinking about myself. And right across, you're all sitting in the Zoom. Okay, what is this lady talking about? What does she know about spirituality? And you can think about my personality. Some of you have met personally me. So when you hear the name of Ramadevi, you can connect with different aspect of me, my personality. So that is all you're connecting to my mind. But the one who really I am, who really we are all, is just the spirit, just the soul. So when the minute once we start making connection at the soul level, we call soul sisters, right? Soul family, Sai family. That means we are all one. The underlying principle, the connecting point is just the soul. Swami says if you just take out the soul, your body is there, your mind is there, but you're only shavam. The soul, the spirit that is present in us is the Shivam. So without the Shiva principle, that oneness that permeates every single atom of the universe, nothing exists. So that is the definition of the health. That is the overall well-being comes from mind, body, and the spirit. So here is the thing. I came across this answer beautifully. Dr. Narasimham, he's in Prashanti. He was leading the mobile clinic and things like he's still very active. Such a nice doctor who does a lot of community work, and I had the fortune to interact with him as well in the past. So one of his videos, it says they all went to Grama Seva and came back. And they said, yes, Swami, we went and did the health camp and whatever. So Swami asked, what is health? And then he started saying, the World Health Organization states it's a state of physical, mental, and well-being, not merely the absence of the disease. Before even he completed, Swami said, stop, stop, stop. So I am telling you, this is the definition of health. A state which depends upon the ahara, the food we eat. So Swami did not say specifically about just the food for the physical body. So the food for our thought, food for the mind, food for the soul, right? The ahara and the vihara, the exercise, and the places we go. He specifically said the places we go, the visit, everyday, day-to-day activity, what we do, that matters as well. And the achara, that is the conduct. It could be a good conduct, bad conduct. So that will tell us how healthy we are. And uchara, that's the anger, it doesn't have to take the form. The feeling inside, the anger feeling, that will completely destroys our health. So I took the course of the Kundalini Yoga. That part of the class is self-introspection. During the class, they talked about feeling on desires, and Swami also talks about sealing on desire. He never said eliminate desire, but when it comes to anger, eliminate anger. Even a trace of anger will just burn you inside, burn us, all of us inside. You doesn't have to say anything angry to anyone. The thought itself will take away the energy. Swami said, specifically said, that will take away the energy that you have stored for 3 months. You're instantaneously losing that kind of energy from your body. And vichara, the thought, obviously we know we need to have pure thoughts. So that is absolutely, that is this, we are gaining the thought through the senses. So absolutely sense control is very much important for our health. And then Swami finishes with all of these, the most important things are the ahara and the vichara are the most important things. And pretty much we can really connect with that, the food and the thought. Those are very, very, very powerful. So that is the definition of health by Swami. So we had asked for shared 3 spiritual practices. I'm also watching my time, sorry. So everyone said, I really like the gratitude, selfless service, prayer, meditation. So we definitely know what is the spiritual practice. And then 3 healthy habits, definitely eating healthy, exercise, yoga, showing gratitude. So pretty much very similar, right? Healthy habits and spiritual habits are very similar. Is it necessary to be healthy to experience spirituality? So this is a kind of a tricky question. So 51% of you said, yes, we need to be very healthy to experience spirituality. In one way, it is correct. 18% maybe. So I will include that 18% to this 51%. So only 30% said no. So that means we don't have to have healthy body or healthy mind to experience spirituality. And I would agree with that, because there are so many people with so much of physical ailment, people going through cancer or any devastating health condition. I've seen people with so much of joy and equanimity. So they exhibit spirituality even though they're going through a lot of calamities physically. I've seen families going through a lot of mental problems. They can have their own mental issues, or family going through a lot of chaos and confusion. I don't want to mention a country, but there are some country going through a hell of a time now. But children, even everyone, they hold on to the faith and God. So they are literally going through that, but still, what is holding them alive is the spirituality. So whether you're physically, mentally healthy, you still can experience the spirituality because it exists all the time with us. It's not separate from us. Do you need to be spiritual to be healthy? 67 said yes, 25% no. But I think my goal is to see 100% yes at the end of the session. So spirituality is the basis for our well-being. Let's see what Swami says. the one effective way to conquer all sources of physical and mental disease and debility awareness of one's atmic reality. And Swami had talked a lot about medical and health issues, and he always reemphasizes do not even prescribe medicine, teach spirituality. Prevention is more important. So he has given so much of importance to preventing diseases. So definitely the Atmic principle is the core of our well-being. So now that neuroscience is just evolving, there is so much of research, neuropsychiatry, neuroscience, and I have a couple of neurologists present in this session. They can definitely vouch for this. So many things going on, but are we truly born with the spirituality? Yes, we are. So that's what the neuroscience is. Our brain is wired already for morality, understanding others, compassion, self control, sense control, caregiving, everything is already there. But the minute our sense predominates, we lose it. So when the child is born, the baby is absolutely happy. They don't have any judgment, they don't have any anger, no hatred, no jealousy, none of those. But it doesn't take that long. By 6 months, the child is starting to see the vision predominates, the smell and the ears, everything is going, the antenna is speaking out. The fear factors come in. By the time they're 2, they are terrible. So that's why we call terrible twos. So we have this beautiful brain. We have this limbic system. In Ayurveda, they call the limbic system as the Hridayam, because that controls the emotion and it definitely takes control over the entire system of our body. So this is where our emotional factors are here. But what is that constant integrated awareness? Whatever we feel and everything that comes through our senses, that's why Swami has I've given you buddhi. Buddhi Leda, he asked, right? If you don't do anything right. So we are given that intellect. So we have to integrate with that awareness, constant integrated awareness. Whatever I'm getting from outside, is that the truth? Is it loving? Is it the right thing to do? Right? So that process should never stop. Every breath should have that constant integrated awareness. The brain has millions of neuronal activity going on, and each and every one of us, we are just a speck of the earth. We have all the 5 elements that is present in the earth in all of us, within all of us. We have the water element, we have the ether element, we have the Vayu principle, like everything, the fire, everything is within ourselves. So it's so beautiful when we have that knowledge, we derive energy from those sources. We don't even have to have energy from outside. So that is the reason the more spiritual people, they don't have to sleep. They don't have to even eat. They can sit in the samadhi state even though they're alive. They derive energy that is from within. And Swami says, we all, each and every one of us, have the capacity to do that. But we are, on the contrary, losing our energy through our senses because of our anger, jealousy, hatred, whatnot. And the list goes on. So the brain is a beautiful structure. It's given to us to experience the divinity. So definitely the Hridaya, the limbic system is the Hridaya. So what are the tools? There are so many tools. I cannot prescribe that one tool that's going to work for all of us. So we have to find out what is keeping me grounded in my day-to-day practice. When I'm sitting and doing my prayer and my meditation, I feel so grounded and happy. Is it the way I'm feeling when I'm at work? Is that the way I feel when I am being bombarded? Somebody is accusing me. Can I just see the divine in that person? Right? So those things we have to go through the self-audit, self-awareness, self-reflection, self-introspection. If you see, it's all self, 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 self. So each and every individual, we have to do a lot of work on our own self. That's when we truly become very healthy. So again, interestingly, the neuroscience paper says the gratitude, what are the effect on the brain? And we teach gratitude. And obviously, when we wake up in the morning, thank you, Swami, for this beautiful instrument. How can I use this body to experience you? How can I use this body to see you? If that's the goal of life, we wake up and every single act we do becomes an offering to Swami with the gratitude. So what does it do in our brain? It enhances the dopamine and serotonin. These are the neurotransmitters for happiness. It wires and fires the neural connections to the bliss center. I was so intrigued to see the word bliss center. Your neuroscience is recognizing there is something beyond this happiness and joy, there is bliss. And it improves a cognitive functioning as well. It reduces fear, anxiety, and all kind of, it reduces the stress hormones, and I can go on and on and on. So obviously gratitude, and we're all practicing optimism for this quarter in SSC. It's very important to have gratitude. It also, gratitude gives selflessness. It's part of spirituality, empathy, self-esteem. Obviously, when we have all these qualities, we are going to be very happy. So what are the benefits? They really beautifully divided this into physical benefit, psychological benefit, and social benefit. I was amazed to see the social benefits as well. So physical, obviously, will have better immune system, less body ache because you're totally relaxed. Your muscles are not getting tensed, right? And there is no, you have good blood pressure, and you're just like an athlete. If you're a spiritual athlete, your heart rate is going to be 72. That's why Swami has always had the same weight, same temperature, same blood pressure. So it's so beautiful how spirituality can maintain your health. And obviously better sleep-wake cycles as well. And what are the psychological effect? Positive emotion and thoughts, more awake, and we are more awake and alert. That improves our self-satisfaction because it's integrated with the gratitude, the human values. What are the social benefits? Because we are so grounded, we are calm and composed, we'll have better communication skills, more empathy for other people's suffering, stronger interpersonal relationship, and obviously people will like you, they feel the vibration, the love you bring in, more involvement as a team member, and that leads to complete selfless service. So common factors for health and spirituality, I was just thinking, what connects these two? Again, Swami says duty, discipline, and determination. So for Swami says, without discipline, devotion cannot come. Duty, discipline, and then devotion. For physical, mental health, same. We need to do our duty. We need to maintain this instrument given to us. We need to have the discipline so that we can all process through and what it means to us. I don't want to give one recipe for all. So that is our own internal journey. You can figure that out. And I wanted to touch upon a little bit about how this organization is structured for our own well-being. So again, this is all, when I contemplated, this is exactly Swami said, and this is kind of mentioned in Bhagavad Gita as well. Bhakti yoga, that is more for a physical discipline. Okay, if I sign up for the bhajan, I have to maintain the time, I have to practice. And clapping, Swami has emphasized so much on clapping during devotional singing that drives away all the negative thoughts and negative energy in your body. And I wanted to share a personal experience here. I had a whiplash injury, was suffering for so long, for almost a year. And then once I went to bhajan and started clapping, that was the very first time, I should say, in the United States I went for bhajan. I just participated for almost a 1.5 hour bhajan for Swami's birthday. I came back and, oh my God, where did my numbness in my hands go? Where's my pain now? I immediately felt the difference. So definitely it works. So that is the Bhakti Yoga is for our physical discipline. The Jnana Yoga, that is the study circle. So whenever we think about human values and discipline and everything, we immediately push it for the SSC children. I think it starts with us, for all of us. So when the children are attending SSC and we also sit in study circle and we gain the knowledge, without the knowledge, we cannot do the service. Even only with the Jnana Yoga, even when I offered the singing, I will have the right attitude with which I'm offering to Swami, not like a show off for not showing my talent of singing, but with the devotion, connecting myself to the God, the divine, and taking everyone along with that divine experience. So it becomes a service. And definitely for the spirit, there is no other treatment other than selfless service. And Swami had definitely given so much emphasis on selfless service. And absolutely, I can quote so many experiences how selfless service had healed depression, anxiety, or even physical ailment. So that's a beautiful opportunity that we are all given. Very blessed to be part of this service, part of the wing, where Swami has really blessed all of us. So finally, so what is really the take-home message? One single formula, if you wanted to take home, Swami's is purity is enlightenment. So how do we live a healthy life? Living his message. Living the transformed life is the only way to lead a healthy life. So that starts with the purity. With that purity, we have unity in our thought, word, and action. That leads to bliss, and ultimately we will realize that we are divine, and that is the whole purpose of this birth itself. And again, if you relate to the 5 human values, if you look at it, if you think about the truth, being aware who we are constantly, that's the truth. That will take us back to the truth. And making healthy choices, commitment, self-control, sense control, everything comes under right action. And practicing mindfulness, calmness, and self-confidence, self-acceptance, so we make peace with our own self. And Swami says, without self-confidence, you cannot have faith in God, or you cannot even take a step towards faith, right? So self-confidence is the seed for faith. Love, obviously, compassion, respect, and thoughtfulness for our own self and people around us. Non-violence is prioritizing self-care, doing no harm to ourselves, both in thought, word, and action as well. So I really emphasizes this aspect when I do a lot of community teaching to prevent suicidal thoughts and things like that. And I do one-on-one in the clinic as well. But I see a lot of children, at least 2 or 3 children, I send them to the ER because of the suicidal tendency. So that it is so predominant. It is very predominant in the society. And our children are growing up in the society. It's really, really important for all of us to be very cognizant of this, and taking Swami's messages to the society is very important. And here we go. I wanted to touch upon a little bit about the EASE program. So eat responsibly. We didn't say eat healthy. Eat responsibly, whatever it means to yourself, and exercise regularly and sleep deeply. There is no prescription. You sleep for 8 hours, 10 hours, and you wake up this time, that time. It all depends upon you, which is the constant integrated awareness present in each and every individual. So once we start listening to that silent voice inside all of us, then we will have our own recipe to make ourselves happy and healthy. So that is, in a nutshell, that's the EASE program. And by Swami's grace, there is so much interest, and a lot of healthcare providers have taken this. They're taken, and some of them have taken to the community as well. And with that, thank you so much for this wonderful opportunity. And I have a 2-minute video where Swami beautifully summarizes what really health means to us. And I wanted to share that. Please, 1 second.
ఏదో మానసిక అశాంతం, శారీరకమైనటువంటి అసుఖమో, ఇంకే విధమైనటువంటి యొక్క పరిస్థితులు, అన్ని రకములుగా కూడాను ఈ జబ్బులు అనేక రకంగా ఉండినట్టుగా ఈ మానసిక సంబంధమైనటువంటి జబ్బులు అందరికీ ఉంటుండాలి.
There are various sorts of ailments, physical, but this mental
శాంతి, సుఖము, ఆనందము అనేటువంటి మెడిసిన్ కోసమే వస్తున్నారు.
So they all come here to receive the medicine of peace and happiness.
కనుక ఈ పీస్ అనేటువంటిది కూడాను ఎక్కడి నుంచి వచ్చింది?
Where from you get peace?
అనగా బయట నుంచి వచ్చినటువంటిది కాదు.
It's not from outside.
అది తన యందే ఉంటున్నది.
It is within you.
తన రోగం ఎక్కడో బయట నుంచి వచ్చినటువంటిది కాదు.
It's not the one from outside.
తన యందే ఉంటున్నది.
It is in you.
కారణం ఏమిటి ఈ రోగానికి?
What is the reason for the disease?
కారణము.
This is the only one.
ఎందుకు? దుర్గుణముల లోపల చేరిపోవడం చేతనే ఈ యొక్క దేహం కూడా, ఆరోగ్యం కూడా పాడైపోతుండాలి.
Because of bad qualities you are put to sickness.
ప్రతి మానవుని యొక్క శారీరక, మానసిక, ఆధ్యాత్మిక బలమును కోల్పోవడానికి దుర్గుణములే మూల కారణం.
Everyone loses the health of the physical and mental bodies because of the bad qualities. Bad thoughts are
దురాలోచనే మూల కారణము.
wicked thinking.
కనుకనే నిరంతరము సదాలోచన, సత్చింతన, సత్ప్రవర్తనలో మనం ప్రవేశించాలి.
We should always entertain good thoughts and sacred
మన
feelings.
మనసు లోపల ఎలాంటి దుష్ట భావం కూడా ప్రవేశించడానికి ప్రయత్నించినా తక్షణమే దానిని వెనుక తరమాలి.
The moment any bad thoughts enter into your mind,
ఇది నిజంగా మానవుడు చేయవలసినటువంటి కర్తవ్యం.
This is the main duty of man.
కానీ అటు చేయటం లేదు.
That's what we are doing.
వచ్చినవంతా లోపల చేర్చుకుంటున్నాడు.
We accept all that come on the way.
ఇది చాలా చెడ్డ జీవితము.
It's a bad life.
మలమును భుజించే జీవితము.
It's the one that
ఫలమును భుజించేటువంటి వ్యక్తి మలమును భుజించితే రోగములు రాదా?
Naturally you'll fall sick.
చెడ్డను విసర్జించాలి, మంచిని భుజించాలి.
Give up bad and partake good.
ఒక్క పప్పులో కొంత ఉప్పు తక్కువైపోతేనే మనం భుజించడానికి ఇష్టపడము.
When the salt is less in dal, you don't want to eat it.
కొన్ని క్షణాల్లో అయిపోయేటువంటి అన్నం లోపల తన రుచి సరిపోతేనే మనం సహించము.
You don't relish it if the salt is less, because
60
you
ఏళ్ళు,
don't
70
relish
ఏళ్ళు,
the
80
food.
ఏళ్ళు, 90 ఏళ్ళు జీవించేటువంటి మానవులో ఒక రుచి ఉండనక్కర్లేదా?
Should there not be taste in this human life which will be long span, 60, 70, 90 years?
కనుక మన జీవితానికి కూడా ఒక రుచి కావాలి.
Therefore life also needs
ఏమిటా
taste.
రుచి?
What is this taste?
భగవత్ చింతనే మన రుచి.
Thinking of the Lord is the real
సద్భావనే మన
taste.
రుచి.
Good thoughts,
సదాలోచనలే మన రుచి.
good thinking,
సత్ప్రవర్తనే మన రుచి.
good behavior.
కానీ హృదయం నిండుకుడును దుర్భావములు, దుశ్చింతనలు, దురాలోచనలు నింపుకొని మంచి సద్భావములు పెట్టుకోవాలంటే ఇది లోపల చేరవు.
That only makes you happy, but keep filling your heart with bad feelings and wicked thoughts. You cannot
ఏమి లేని
have
బుర్రలోన ఏమైనా చేర్చవచ్చు.
that brain which is empty, you can stuff it with anything.
ఏమేమో చేరి ఉన్న తలబుర్రది ఖాళీయగునా?
That which is already filled, can it ever be?
తలబుర్రది ఖాళీగాక ఇలా సుకృతము నింపనగునా?
Without being empty, can it fill it with spiritual knowledge?
మొట్టమొదటి దుర్గుణాన్ని దూరం చేసినప్పుడే సద్గుణాన్ని నింపడానికి వీలవుతుంది.
Then give up the bad qualities, then you can fill it up with good qualities.
Thank you, Sister Ramadevi. That was a beautiful presentation, so beautifully connected, health, spirituality, and just the way you tied it up with human values. And thank you for showing us that, spirituality is the basis of well-being. I do have a request to all the sisters, so please post your questions in the chat group so that, we can share it with Sister Ramadevi. So we do have a few questions here. The first one is...
I've been a Sai Baba devotee for over 40 years, and I really liked her talk. It was excellent. But my comment is the constant integrated awareness has a practical application when it comes to health and the spirit. Okay? If in going through our daily activities in the Kali Yuga age, my question is, we have to interact with family, people, work, job, and all these other things. And if you practice the constant integrated awareness, that practical application, it becomes an innate part of you. How can we better do that in terms of teaching it to other people by our role model, other than trying to push Christianity on them or push Sai Baba on them? You want to be that role model that allows them to not have the negative energy, to not have anger, all this other stuff. So how can we take that constant integrated awareness and try to have it be learned by others in our own environment during the Kali Yuga age? Because there are many, many challenges. That's my question.
Sairam, sister, thank you so much for that question. You have rightly pointed out that our goal is not going out and pushing any religion. That is very clear.
Right.
So that's the reason we started with what is spirituality. We need to have a clear, good understanding what spirituality means. Once we have that, my agenda is not going to convert everyone into Sai Baba devotee. Absolutely not. Because they are divine. If I am a true Sai devotee, I will go out and see for myself and believing that my Swami is present in the other person. That is my job. So I am going to do my work. In that process, the transformation beautifully happens. How do we do it practically? I wanted to share one experience. I'm very grateful to my patients. They are my greatest teachers, and they help me to grow spiritually and be well grounded on the couple of experiences. But I wanted to share this one profound experience, how I learned it, how to keep my peace and calm, and to remember that who I am and remember that who the other person is also, right? So this is a patient, few of you must have heard this story. Please pardon me. But this is the beautiful lesson I learned, and I could think about it every day in and day out. This lady came with the 3 children, and she was my patient. So every time I go and see the patient, I knock the door and I will say, Swami, you are the doctor going in, and you are the patient sitting inside. I don't have this physical Ramadevi had nothing to do with this, right? I'm a bystander. So learning to dissociate from you, from this body, and manifesting that awareness, the divinity within ourselves, reminding that. So I went inside anyway. And then that was the very first time I'm meeting this patient, and she asked, why are you here? That was her very first question. And I said, ma'am, you know that you're going to see me. Oh, yeah, I know that because my doctor is not here. I have to see you. Is it okay if I start seeing your child? She said, yeah, go ahead. And then I started seeing the first child. Why are you smiling with my child? Why are you playing with my child? Constantly she was interrupting. And I was like, ma'am, I'm a pediatrician, so I have to play with your child so your child can cooperate with me. Yeah, go ahead. Then I started seeing her second child, and she said, I don't know, whatever she was telling, and then she started using a lot of abusive words for no reason. Then internally, I'm having a conversation. We can perform mind level. With the mind, I'm doing the task of, as a doctor, what I'm supposed to do. But my Atma is working at the different level. I said, Swami, you're sitting verily in front of me, and I know you're enjoying this process and you're testing me. Give me the courage and strength to pass this test. I cannot fail this test, right? This is an internal conversation. So that completely cooled me down because the Swami is sitting at me and yelling at me, which is okay. I'm ready to take it. And the third baby was sitting with so much of respiratory distress. So I gave her a lot of medicine, nerve treatments and whatnot. Everything was done. And I wrote my cell phone number. Ma'am, this is my cell number. I'm on call today. If your baby is very sick, don't go and wait in the ER for 4 or 5 hours. You call me, I will admit you to the hospital immediately. She just grabbed it, like literally grabbed it, and then she just walked out. Obviously, I didn't expect any thank you, none of those. And I was extremely peaceful. I came to my office and looked at Swami's photo and said, okay, as a mother, you should be proud of me. I think I passed the test, Swami. And I was so happy and blissful to the core. But if I had been attached to my physical, hey, I'm a doctor, who are you to yell at me? The protocol in the hospital is if somebody is not behaving, you call the security, walk them out of the clinic. I could have done it, but as a Sai devotee, I'm seeing only Swami there. I'm not seeing the person who's yelling at me. So that made me so peaceful. And guess what? The story didn't end here, right? This is the second part is the most important aspect of it because this lady calls after 2 weeks. But anyway, my nurses and everything, they put an alert on this chart that when this lady calls, she's not going to see Dr. Sankran. That's the deal. But she calls 2 weeks later and she said, I wanted to see Dr. Sankran. Really? No, ma'am, I need to check with Dr. Sankran. They asked me, and the receptionist came and asked me, I looked at Swami's picture. Swami, you wanted to come and test me again? I'm ready for this test again. So you make the conversation. Spirituality is fun, right? It's not serious at all. It's a constant having that conversation.
Right. Constant integrated awareness.
That is the integrated awareness. This lady came.
But the application of the integrated awareness.
So this lady came, and as soon as I entered the room this time, every single word I uttered, she said, thank you. So if I had the judgment, if I had said, oh my God, she yelled at me, I'm not going to see her, I missed this opportunity to experience the divinity in the person. So as you rightly mentioned at the beginning, sister, it's our behavior. As we manifest our own divinity, we allow other person to exhibit divinity. So that's what the whole world needs. We want transformation, not the information is plenty. The information you click in the YouTube, you get so much of spiritual information is right there. But we want transformation. So take every word into the heart, not to the brain. Eliminate the mind. So yeah, thank you.
Thank you. Thank you. That was excellent. Thank you.
Thank you, Sister Ramadevi. That was a beautiful, story. Please, thank you for, sharing with us. There is one more question in the chat. How does karma affect health? Yeah. So karma, it's a baggage. We come, right? So when I do this parenting workshop, I usually talk about this karma. We are receiving that soul. That's the newborn that's being born, right? Some of the newborn babies, they are born with some congenital heart problem. Some babies, they just live for a few hours and then they're gone. So whatever that is happening to us at the physical level, mental level, each one of us we have come with our own script. So Swami says there are certain karma he can eliminate, but definitely spirituality is a beautiful anesthesia. You go through the pain without the pain. So the karma we have to go through, especially being a Sai devotee, I wanted to go through it right now because I know I have a beautiful cushion, an anesthesia to hold on. I have a big pillar to lean on. This is the birth. We can go through this karma beautifully. That's my thought, sister. So we'll move on to the next question. Can you give guidance on how to help people with mental health while working in behavioral medicine with spirituality? Awesome. That's my favorite question because that's the work I do every day with the children as well. So that's what we do, this human values program.
I would say human values is the prescription. That is the prescription. Okay. I have seen so many children going through, it's like a laundry list. They have come with the medicines. So many medicine completely messes up their brain system. And I've seen a lot of children going through this therapy, that therapy, until they connect with their own conscience. Nobody can heal them. But how do we help them to connect with their conscience? That's the only way we can treat a mental health problem or behavioral health issues. Unfortunately, the behavioral health problem is increasing every day. I wanted to give you another one beautiful example I learned from. Do we have time for that, sister? I want to share this one
Go
example.
ahead, sister. Yes.
So I had a teenager, a ninth grader, who came to me. This was like May 12, 13, many years ago, I should say. This girl, I have permission to share her story as well. So she had lot of bad, she has picked up, as Swami said, a lot of bad things she has taken up in her mind. The reason, she said, I don't have love. I'm not receiving the love what I wanted because both of her parents are in prison. So she's lacking that maternal love. And I totally can, I don't think I can even empathize because I have never experienced it, but I could feel for her pain. But that doesn't mean that she should go in the wrong direction. But anyway, that's the path. The teenagers, that's what she's exposed to. That's what she's surrounded by. And this child was brought in by the grandma, who's a hardcore Christian, faithful, spiritual lady. And she is in tears. Dr. Sankar, I don't know how to help this girl. Obviously, she's teaching all the spiritual aspect of life and everything, but nothing goes to her. So when she came to the clinic, it was a 15-minute appointment. I was connecting with Swami. Swami, you have given this beautiful soul to me, but this Dr. Ramadevi, pediatrician, cannot treat this condition. It is the divine doctor within me can touch that soul. So every doctor, it is, we do our job. The cure comes from the divine. So we need to have that firm faith when we do with any patients. That is extremely important. I'm just doing my duty to do, but the result is in the divine hand. So that's how there is.
And you have to look for the result because he'll give it to you, but you have to look for it. It's there.
It's there, but however it comes, I'm not anticipating this is what should be the result. I am just open because the divinity, when you give it to divine hand, you don't dictate what should be done. You surrender. As a doctor, I need to surrender to the divinity within myself. So
right.
out of that came love and respect for the child. So I just, okay, honey, you just tell me what is going on in your life. And she just poured her heart out. 15-minute appointment became 45-minute appointment. But I told my nurses, hey, this is a very important case. I cannot leave. Tell my other patients. If they wanted to wait, they can wait. Otherwise, they have to reschedule. So I started talking and she just as Swami rightly mentioned, the discourse, every single word is very profound. She emptied her mind completely. So allowing the time and space for her to do that and giving her the reassurance and confidence that it's going to be 100% confidential, she trusted me and she just poured everything out. Then she was in a listening mode now. Okay, honey, this is all problem that exists. Okay, let's just take one thing. What is the major problem you're going through? I cannot sleep. And unfortunately, if I'm seeing 30 patients, 20 of them have sleep problem. Parents ask a 5-year-old, what kind of sleep medicine I can give for my child? It's very unfortunate. That's a completely different topic. We may not have time for that today. A lot of societal factors. But anyways, this child started with the sleep. Okay, are you doing this? Yes, I have my TV on, I have my phone, I'm constantly texting my friends because I feel lonely, blah, 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 whatever. She's finding excuses to do this. I said, honey, we need to fix your sleep. Whatever step you wanted to take, let's take this. She said, oh, Dr. Sankaran, do you think the TV is affecting me? Yes, honey. So I explained to her what happens in the brain waves and a little bit of scientific. They want proof, right, for everything. So I gave her some scientific knowledge. She said, sure, I can do this. She went home. She took the TV out of her bedroom by herself. The grandma was so thankful. So I see one change, Dr. Sankran. Then I brought her back a couple weeks. Then she said, I'm sleeping better, but still phone is a distraction. This is all coming from the girl itself. I'm not telling anything. She said, okay, Dr. Sankran, I think, honey, this phone is a big distraction. Even if you're a president of the United States, you shouldn't be bothering about other people's life in the night. You should have your sleep. Then she just laughed at it and then, okay, sure. The phone was out of the bedroom. 3 months later, she comes. Her grades went up. Bad friends left her because she's not engaging with them anymore. She started seeing the light within her. The self-confidence dawned on her. Once the self-confidence come in, then the faith in herself comes, right? After 3 months, she said, Dr. Sankran, I wanted to be a nurse, wanted to work with you. I know how to help these children because I went through this. That is a beautiful journey because no prescription given. Obviously, for a paperwork, I have to send her to psychiatric therapy and evaluation, and that's part of my job. And so I need to do that as well. And she's waiting for 3 to 6 months to see a psychiatrist. But the healing happened with the spirituality within 3 months. Human value was the only prescription that was given. And guess what? She became a nurse. This happened at 9th grade, and she became a nurse in 2020. So this is like one example. There's so many examples I can go on. The spirituality was the best medicine that worked forever.
But that's a constant integration of not just yourself, but to others. You activated it, but you didn't put the label constant integration on it, you know?
Thank you, sister. I think, those are wonderful tips. I think, it helps all of us too, we get so much distractions with, media and telephones. I think, those are great, not only for kids, but for adults too. We just have one more question and we will end the session after that.
One point, sister, I wanted to reiterate this. Again, Swami says, you have to follow what you're going to say, right? For some reason, me and my husband had taken a vow that we will not watch TV for 1 year. That just a random promise. We made it to Swami, and I was going through that. No TV. So that is another reason when we practice and preach, it clicks right away.
Thank you, sister. So we'll just end the session after this last question. The question is that effects of isolation on health. We know that at the level of Atma, we are all one. It seems that we also need connection at the human level for our physical and mental well-being. Please share your insight.
Yeah, that's a wonderful question. Until you have made that connection within yourself, it is very hard to be alone. But to grow spiritually, we have to be very comfortable with our own self. The worst fear we all have is facing our own truth. That is the worst fear. But somehow we need to start the journey so that we can be comfortable alone. So when I worked in the hospital, I used to do on-call, and I'm away from my family. Some weekends, like nobody, this is in a remote place that hospital is. My mom used to get worried. You're always away from the home, and you're just be yourself. And you said you're very happy just being yourself. My mom started worrying. He said everything is okay with family. But in a spiritual sense, it is just a constant conversation within yourself. It's nothing but Swami that opens up beautiful insight. There is a beautiful world within ourselves. Once you had that glimpse of that experience, you don't want to be out of that. Truly. You can be with other noises, but everything else become a noise. Going within yourself and enjoying that loneliness within yourself, that is not a loneliness. It's a huge world within you. But I will not recommend if you're not comfortable, but slowly, that's when take 5 minutes and see how you feel being yourself. And you just journal your thoughts. But when you journal, don't just stop journaling your negative thoughts. You write a positive thought, like a counteractive positive thought as well. So the more we write, the Likita Jabam, Swami says, right? The more we start journaling in psychiatry, they talk about journaling. People will pour out their negative thought and they go and read again. So you're reconfirming your negative thought. It's going to screw up even more. But you pour out once your negative thought, tear it apart. You write more positive things. That's extremely important. So that will make you very powerful within yourself. But that comes with the practice. I wouldn't say everyone should be lonely. Absolutely not. But as we grow spiritually, you will be the most happiest person when you're alone. Because Swami says, when I'm alone, I know I'm God. And that's exactly we all will feel. When we're alone, we know that we are God. Sometimes we are fearful of being God.